quite well. I think the problem that we have today is really the financing of healthcare. So I strongly believe that we need to move to a single payer, which is what I've been talking about, and we need to get rid of this multi-system, multiple insurances. Why are we getting our insurance from our employer? We don't have one employer through our entire life. You know, as a matter of fact, you don't have an employer if you're 10 years old. So why are you getting an insurance from your employer? Why not just pay the taxes? You know, taxes are the fairest way to collect money for a group. And then, you know, let the legislators work out what benefits they're going to agree to for the different individuals in the society based on their age. You know, a pregnant woman doesn't need the same set of services as a 2-year-old child, and a 2-year-old child doesn't need the same set of services as an 80-year-old. So we can work all of that out. We already know what they need. What we don't need is just a whole lot of different insurance companies creating different plans for everybody and making it so extremely difficult. When I took commercial insurances, most of the time I had no idea what the individual's insurance covered. I would go ahead and treat, and then I would hope for the best, hope that it was covered, hope that they don't charge the patient a whole lot of money for the service that I ordered, and hope that I get paid. And that's the reality that exists currently. So it is a mess. It is a real mess.
So how did the whole Affordable Care Act affect you?
Well, the purpose of the Affordable Care Act was to increase the amount of people that are insured. I think that's a travesty. First of all, why do we have 50 million people in the country that don't have insurance? That doesn't make any sense. Because, yes, you know, we all believe that everybody should be taken care of. I don't know anybody who believes that a sick person ought to be left on the sidewalk to just sit there and die. I don't know anybody that believes that. So we all agree that we want that person taken care of. So if the person can't afford to take care of it themselves, then we all pitch in. That's what we all would do. So why don't we just have a system to do that? Why then did the Affordable Care Act send that individual to some exchange website to buy commercial insurance? Why didn't we just give that person Medicare? Why didn't we give, well, you know, we did give some Medicaid, we expanded Medicaid, but that didn't make a lot of sense, because now you and I are going to pay for that person without insurance, giving the commercial insurance company 20% of that dollar in order to provide the care. We could have spent the whole dollar on the care, or at least 98 cents. Medicare would take 2% for its administrative charge. Going back to the commercial insurances and the relationship with the patient, we do not need any commercial insurance in medicine today. We don't need hundreds of insurance companies making life more difficult for patients, making life more difficult for doctors, making life more difficult for the hospital. These commercial insurances, the bottom line is profit. Their mission is not care for people. Their mission is profit for their shareholders. If they're non-profit, their mission is still profit. You know, non-profit is a euphemism. You know, so the bottom line is we don't need that. If healthcare is a basic human right, and I believe it is, then we should make it as simple as possible. Why not just have one insurance? Patients should have choices of doctors. They should have choices of hospitals. They should have choices of their health facilities, not choices of insurance companies. As a matter of fact, the more insurance companies you have is the less your choice. What do I mean by that? Every physician can't belong to every commercial insurance. So what generally happens is this particular commercial insurance will encourage a group of doctors to belong to their network. Then the other one will have another set of doctors belonging to their network. Then they fight amongst each other to sign the patients up. So this commercial insurance has this group of patients and this group of hospitals and physicians within their panel. If you try to leave that network, you're penalized. Either they don't cover the service or you have to pay extra out of your own pocket in order to go out of network. If everybody had Medicare, right? Let's say we all had Medicare from cradle to grave, one single insurance, then doesn't matter. You go to Dr. Moore, of course, it's only one insurance. So he's going to take Medicare. You go to Dr. Smith, only one insurance. He's going to take Medicare. You go to Methodist Hospital, doesn't matter. They take Medicare. You go to Cornell, Weill Cornell, they take Medicare. You go anywhere in the country, it's the same insurance, one insurance. So why don't we just have one insurance from cradle to grave for everybody? Medicare operates with a cost of 3%, 2 to 3%. Do you know the commercial insurance operate with an administrative cost of between 20 and 30%? So that's the amount of your health dollar that's going to the administrative process. That's not any part of your care. So we don't need them. Why do you think we have them? We have them so that people can make money. That's the only reason, so that people can make money off your health delivery. It's totally unnecessary. And there are a lot of people that agree with me on that one. There's some people that don't agree, but those people are basically out to make a profit off your health. Well, one of the things that I fight for or struggle to do is I struggle to eliminate commercial insurances from the healthcare delivery system in the United States. And I work, as a matter of fact, before I came here, I was at a meeting of a physicians group that is their mission. Physician for a National Health Program. They support single payer. So that would be a breakthrough. I think certainly, I come from a medical school where half of my colleagues are discovering things. Folks I went to medical school with, they spend a lot of time in the lab and they're discovering things, and I think that's great. I'm glad that they're doing it because I need the tools. But what I want to see is I want to be the guy that helps the medicine to get to the patient, not necessarily the one that's going to discover the next